Once again, colleagues, good time of the day. And today we'll have the next lecture, and it will be regarding the use of psychoactive substances. And looking on the topic of our lecture, you can understand that it is one of the main topics that you will need to know about. It is caused by that thing that the use of psychoactive substances is a huge problem of the modern social and of the modern people. And people use psychoactive substances during the millions of years. And they use them because they like the effect of these psychoactive substances. Firstly, people notice that some of natural things, for example, natural herbs or natural plants, can give some specific effects that are very pleasurable. And people started to use them in different manners. But if we look on the history of the use of psychoactive substances, we understand that during the previous hundreds or thousands years, these psychoactive substances were used by people who stand in the highest level of the hierarchy of the social. Typically, it were specific magicians, people who did specific rituals in the tribes and in the social groups, and average people didn't use substances because they believe that it's not okay to use them, and if you will use the psychoactive substance, it will bring you to the world of souls, and they didn't want to do it. So in our days, people take different substances, first of all, because they like the effect of them. In some cases, this use is on the recreational level, or we can say it's social level. In other cases, these people become abused or dependent from the psychoactive substances. Others can use them rarely, and it will not lead to the dependence. But if you're talking about this feature of dependence, we don't know which people and when they will have these problems. We don't know because there are a lot of features that potentially can lead to the development of the dependence. First of all, it's genetic factor. We know that genetics plays one of the main roles on the development of the dependence. The second thing, it's a specific psychological state of the person. In some cases, if the person's mental state is not the best, when the person feel anxious, for example, or worried about something, it will lead to the development of the dependence more often than in the cases if the person have good social level of functioning, if the person have a good life. The second thing that we have to understand that there are specific neurotransmitters that works in different people differently. And in the case, if the person, for example, is happy in the life and if the person is have positive thinking, in this case, the ability of development of the dependence is less than in the cases if the person is negativistic and if the person is anxious about the future, about the life. Also, we know that the factors that plays role of the development of the dependencies are factors that are related to the social status of the person. For example, if the person have a lot of money, have a good job, everything is good in the life, and you don't enjoy things in the life, potentially it can lead to the development of the dependence. Because the brain of the person is developed very specific way. We know that everything that leads to the pleasure will potentially lead to the development of the dependence. What does it mean? It means that if the person tried something that will lead to the euphoria, it means to the development of the pleasure. If the person will feel more relaxed, if the person will change the behavior to more pleasant, it will lead to the dependence. It means that our brain is looking for pleasurable things. And if the brain found something that was pleasurable, it will lead to the desire. Desire that will say that you have to use this or you have to do this or that thing. Speaking about the psychoactive substances, we can say that in the case if the person uses any psychoactive substance that is pleasurable, that potentially can lead to the dependence, it will lead to the changes of the work of the brain. If you're talking about the changes of the work of the brain, it means that we change the neurotransmitter level of functioning. It means that there is like a firework in the brain of the person, and the person cannot do anything with this firework of pleasure. And it also becomes that thing that says that the person you have to take this substance because it's very pleasurable. So during our history, during these millions of years that we were developing, we did not learn how to control the use of psychoactive substances, and it means that every person potentially can become dependent and potentially can become dependent very quickly from the psychoactive substances. So we are talking about the dependencies, and first of all, we have to understand what does it mean, because we are talking a lot, but we don't have any thoughts regarding it. First of all, it's acquired urgent need to take any action or to use any substance. In practice, this term has several meanings. What does it mean? Acquired, it means that every person comes to the world without dependency. During the life, we try different things, we use different things, and these things, they lead to the pleasurable features, and these pleasurable features, they potentially can lead to the development of the dependence. There are two main types of the dependencies. It's chemical and not chemical. Characterizing the chemical dependence, we have to say that the main features of it is the use of specific chemical substance that change the work of the brain. It means that we take chemical substance, specific chemical substance from outside of the body and put inside of the body. And in this case, the work of our brain is changing because of the use of this substance. If we would like to characterize a not chemical one, we have to say that specific acts, specific doing muscle work or performing specific activities lead to the changing of the work of the brain. And this work of the brain is characterized by the occurrence of specific increasing or decreasing of the work of the brain. So chemical, we take chemical substance from outside of the body and put inside of the body that changes the work of the brain. And not chemical, we perform something, we do something that leads to the changes of the work of the neurotransmitters in the brain, and it leads to the dependence. Chemical dependencies, they are alcoholism, drug addiction, substance abuse, and not chemical, we have a lot of them in our days, and the most popular is gambling, it's internet dependence, it's shopping dependence, sex addicts, it's people who are dependent from the work, television, sports, religious. If it's simple to understand what does it mean to be addicted from the drugs, what does it mean to have problems with the substances or alcohol, maybe not everybody understands what does it mean to be dependent from the gambling, for example, or internet. Gambling, it's games, for example, cards, it's casino. The features of chemical and not chemical dependence, they are the same. We will talk about them in a few minutes, but for example, if you will think about your life during the last few months, I can say that none of you cannot say that I'm not dependent from my gadget, from my phone, from the internet, from the um, internet relations with people. The person who does not have mental disorders in our days cannot be normal if you're talking about the absence of dependencies regarding the gadgets and modern technologies. Why am I talking about it? Because there are specific features that can tell us that you are dependent. We will talk about these features in a few seconds. Regarding the shopaholism, people not always buy things that are useful in their life. What does it mean? It means that if you have, for example, 5 dresses or 15 dresses, for example, and you buy the 16th one, it means that potentially it is shopaholism. If you have 7 trousers and you buy the 8th one and 9th one and the 10th one, in this case, it also the typical feature of shopaholism. People buy things in this case that are not useful. Sex addicts. In some cases, people become addicted to the sex. What does it mean? It's not like the pleasurable sex. It's that you want to have sexual relations with almost everybody and you are doing it. You make a lot of efforts to have these sexual relations with people. And it's also become the addiction. Workaholics. We are talking about the dependence from the work in the case if the person is doing some specific activities on the work, and these activities potentially leads to the problems with the life of the person. What does it mean, problems with the life? For example, if you are a doctor, you like your work, you prefer being in the work during 15 hours because you are a church or gynecologist or psychiatrist, it doesn't matter who are you. And you have small children that needs your attention. You have, for example, parents that need your help, but you always say that I have a work, I have to do presentations, I have to go to the conferences, I have to work with my patients. In this case, we can say that the work becomes a problem, a social problem. You does not give enough time to your wife, to your children, to your parents. You does not perform the routine activities that you need to do, and it's also become a problem. Television, it's in some cases also a dependence right now, but nowadays this television dependence is changed to the internet dependence, to the gadget dependence. Sports, when are we talking about the dependence from the sport? In the case, if the person um, gives to the sport a lot of time and gives to the sport a lot of efforts, and these efforts potentially lead to the social problems. What does it mean, social problems? It's like almost the same as if you're talking about the workaholics, about people who are dependent from the work. If the person, for example, if the person starts running, yeah, and this person says that I have to run every day. So the person does not communicate with people because he have like the trainings, the person eats specific food, the person does not go to the parties, the person does not use alcohol. For example, in Ukraine, it's not okay if you don't use the alcohol at all. You don't communicate with people because you have the training right now and you have to go. So if you lose social relations and you pay more role to the sports, in this case, we can say that it also depends. And religious, it also has specific features. So speaking about the chemical dependence, we told that in this case, you have to use psychoactive substances. And what is psychoactive substance? It's specific substance that when it is taken or administered in the organism or into one's system, it affects the mental process. Specifically affect the mental process. We have like 3 main types of the psychoactive substances. It's the first group, they stimulate. The second group, they decrease the activity. And the third one, it changes this, the perception of the world, the sensation, the perception. And dependent on these effects, we have specific pleasurable effect. In this case, we're talking that this substance is psychoactive. So on this slide, you can see the list and the pictures of different psychoactive substances. Yeah, it's like cocaine, it's crack, it's methylphenidate. Ritalin is like one of the most popular psychostimulator. It's ephedrine, NMDA, MDMA. It's an ecstasy. It's also very popular in the Europe, in the US, and now in Ukraine. It's also popular. It's LSD, it's mushrooms, and cannabis and others. So you see them. We were talking about it, but I will tell you once again. All psychoactive substances, they affect the work of the human brain. They accelerate the transmission of the sensory signals or prevent nerve centers from performing their functions. The effect of psychoactive substances are based on their effects on the neurotransmitters. And neurotransmitters, it's specific substances that transmit the signals from the one neuron to another. Speaking about the brain, we know that in our brain we have 100 milliards of neurons, billions of neurons. It's specific cells that have specific activity. Yeah, we have like the body, and we have like two axons and dendrite, specific things that connect the neurons with each other. And psychoactive substances, they have influence on the specific neurotransmission system. It means that they change the interrelations between the neurons. Speaking about the psychoactive substances, we have to understand that there are two main groups of psychoactive substances. They are toxicomanic and narcotic. There are three main criteria that typically satisfy the narcotic substance and toxicomanic substance. They have two of these three criteria. So the first criterion is medical. Medical criteria says that the substance must have specific effect on the central nervous system, which is the reason of its not medical use. What does it mean? It means that people use specific psychoactive substance for this specific action on the work of the brain, of the central nervous system, and it becomes the main feature. Why does the person use it? The social criteria says that not medical use leads to the social significance. What does it mean? It means that because of the use of psychoactive substances, the person is starting to have different social problems. Problems with families, problems with the job, problems with the health, and even if the person understands that there are problems, or when there is a specific conflict, or if the person can lose the job, still the person continue uses this psychoactive substance. So toxicomanic substances, they have these two criteria. If the substance have the third criteria, it's legal criteria. In this case, we can say that this substance is in the list of narcotics. So the drug in the prescribed manner recognized as narcotic and introduced by the Ministry of Health of the country to the list of narcotic substances. It means that every country have a list of psychoactive substances that are narcotics. And if you use it, if you sell it, if you have it, it's illegal, and potentially it will lead to the problems with the law. And so once again, if the substance has three criteria, it's narcotic. If the third criteria, legal criteria, is absent, in this case, we are talking about the toxicomanic substances. But if we look on these criteria, we understand that psychoactive substances from the toxicomanic group and narcotics, it's the same. But you can use, sell, have the toxicomanic ones, and you don't have rights, you don't have real legal ability to use them and to have them. It will lead to the problems if it's narcotic. If they're talking about the Caffeine, if you're talking about the tannin that is in the tea, if you're talking about the alcohol, in these cases, we are talking about the toxicomanic substances, but they have all the features that narcotics have. And narcotics, you know that it's, for example, LSD, it's amphetamine, it's cocaine, it's opiates. We know that if the person uses the psychoactive substances, as a rule, it causes the formation of the psychical and physical dependencies. What is physical dependence? It's one of the main features that you have to know about the dependencies. Physical dependence is a physical condition caused by the chronic use of a tolerance-forming drug in which abrupt or gradual drug withdrawal causes unpleasant physical symptoms. What does it mean? It means that the person is using psychoactive substance for some periods of time. For example, it's coffee. You drink coffee during a few months every morning and you feel that coffee is tasty, the coffee gives you energy, but then you went to some place where you cannot find the coffee. And you are in this place during 1 week. You stop drinking coffee, and in this case, you have unpleasant different somatic symptoms. It can be headache, it can be problems with blood pressure. You are unable to keep things because you have the tremor. You can have the nausea, you can have the vomiting, muscle pain. In this case, we are talking about specific physical symptoms that occurred after the interruption of the use of psychoactive substance. Physical dependence can develop from the low doses of therapeutic use of certain medications such as benzodiazepines, opioids, antiepileptic medications, antidepressants, and also it can be the alcohol, opioids, amphetamine, and benzodiazepines that are used in the non-medical conditions. So the main features of this dependence is withdrawal syndrome. Psychological dependence is the state that involves emotional, motivational withdrawal symptoms. For example, anxiety, anhedonia upon cessation of drug use or certain behaviors. What does it mean? It means that the person stops taking psychoactive substance or the dose of psychoactive substance is less than the person needs. In this case, some specific mental symptoms can occur. As I told you on the beginning of the lecture, if the person tried psychoactive substance, in this case, the brain understood that it is very pleasant and this action become desirable. The person wants to continue taking the substance because the effect is like very pleasurable. And the brain says that, please, you have to continue taking it. If the person stops doing it, first of all, the brain says that, give me the substance. Also, we know that if the person took any specific psychoactive substance, it leads to the changes of the work of the neurotransmitters. It means that, for example, if you use alcohol, in this case, the person can have a lot of receptors for opiates in the brain. And if the person withdraws the alcohol, in this case, these receptors want to have opioids. Yeah. Why did these receptors increase? Because if we take alcohol, it increases the level of opiates in the brain. And if we have a lot of opiates, it means that we have the brain thinks that he needs more and more receptors. So they occur in the brain. If the person stops taking alcohol, in this case, every receptor says that I need opiates to work properly. And if there is not enough opiates, in this case, the brain begins to work on it inadequately. So the symptoms like problems with sleep, inability to concentrate, anxiety, negative thinking, they occur, and the person can do nothing with this. It will last until that moment when the brain changes its structure. It can last for example, few weeks, few months in some cases. It means that psychoactive substances, they lead to the specific um, changes of the structure of the brain, and it becomes the main feature of this psychological dependence. So the major difference between the psychological dependence and the physical dependence are the symptoms that they cause. If we are talking about the psychological dependence, they cause the emotional motivational withdrawal. Physical dependence, they entail the somatic symptoms, for example, increased heart rate, sweating, tremor, vomiting, and others. So another thing that we have to know about the dependencies, it's also one of the main syndromes, it's syndrome of tolerance, and the second syndrome, it's the syndrome of withdrawal. The tolerance, it's specific syndrome, and it's said to occur when the patient has to take increasing amounts of the substance or to get for getting the desired effect. Tolerance may also be interfered when over time, even through the patient continues to use the same amount of the substance, but the desired effect does not come. What does it mean? It means that if you tried to smoke ever, or if you tried alcohol ever, or if you use any other specific psychoactive substance, you know that if you start taking it, you typically have specific effects. What effects typically the person have? If you're talking about the smoking, it's cough, it's nausea, it can be vomiting, it can be headache, it can be feeling of rounding the world. It means that if the toxin comes into the body, the brain understands that it's not normal to use it, and he wants to stop taking it. So it wants to put the substance out. So if the person continues, for example, smoking, in this case, this cough, nausea, vomiting stops, and you don't have these negative effects. It means that the organism, the brain, it adapts to the substance. And if you will think about the psychoactive effect, for example, from the alcohol, if you remember, if you have tried to drink alcohol, for example, if the average person starts drinking the alcohol, if you want to be drunk very much, you have to use near 100, 150 milliliters of strong alcohol. It's like vodka, it's whiskey, cognac, rum. If the person were drinking the alcohol for years, for example, the person comes to the medical university of other country and were living without parents and tried drinking alcohol for 3 years. After 3 years of continuous drinking, the person can have very high tolerance. For example, the person can drink 5 milliliters of strong alcohol, or even liter, or even higher doses of it to become drunk. It means that the amount of substance increased in many times. Sometimes it can be 10 or 20 even times. So if the person will use the same amount of the substance that previously led to the desired effect, for example, to the drunkenness, the person will not have the same effect. In this case, we are talking also about the tolerance. Withdrawal symptoms are symptoms that occurs after the use is discontinued, and it leads to the rebound symptoms. The example of withdrawal can be, as I told you before, for example, when you came to the vacation and there is no coffee. and you are drinking coffee for some months. Yeah, you will have the withdrawal symptoms. All the patients who were taking the benzodiazepines prescribed by the doctor for years, and then the person stops taking them because also he went to some vacation, and it will lead to the specific symptoms. It will be typically it will be this withdrawal of sleep, disorders of sleep. It can be the problems with concentration. It can be tremors. Sometimes even it can be the seizures of the person. And also one of the main features of the withdrawal symptoms is the presence of specific thoughts. Specific thoughts that have name the obsessive thoughts. Obsessive thought is thought that is very strong, that comes to the brain of the person, and the person understands that he has to satisfy this thought. What does it mean? It means that the thought regarding that you have to continue drinking alcohol or you have to continue smoking. Yeah, the person understands that it's not okay to smoke. The person understands that it will lead to the problems with the health, but still cannot stop these thoughts because they are stronger than the person. And if you will not satisfy these thoughts, it will lead to the presence of the anxiety. And this anxiety is one of the main features of the dependence. So if the person does not use the psychoactive substance, as a rule, these thoughts lead to this anxiety. This anxiety is developed so much that the person cannot work, cannot do anything, cannot live even adequately because these thoughts comes to the brain again and again. We can say that in the past, the phenomena of tolerance and withdrawal, they have been termed physiological dependence. Now, the word dependence conjures up the images of addiction, and now it's better to use the term neuroadaptation. On this slide, you can see the main symptoms of nicotine withdrawal. It's urge to smoke or cravings, it's restlessness or difficulty concentrating, difficulty sleeping, irritability or anger, anxiety or low mood. Less common nicotine withdrawal symptoms are cold symptoms such as coughing, sore throat and sneezing, constipation, diarrhea, stomach aches or nausea, dizziness or feeling of lightheaded, mouth ulcers. So now you understand what does it mean withdrawal symptoms. We know that most of people in some periods of their lives, they experiment with the substances. It can be the nicotine, it can be the caffeine, sometimes it's tea, alcohol, it can be cannabis, or sometimes it can be cocaine, amphetamine, and others. A typical example of this recreational use is morning cup of coffee or morning cup of tea. And social drinkings in the Europe is also typical examples. In some cases, the substances produces some sort of dysphoria and the person never uses it again. An example would be the teenager who gets paranoid when the first time he smoked the marijuana. And in other cases, the peer pressure or sudden appreciation for the effects of the substances may prompt the patient to use the substance occasionally. So there is also one feature that plays one of the main roles in the development of the dependence. This role is the development of pleasurable symptoms and absence of the negative symptoms. For example, if you use the psychoactive substance and it leads to the euphoria, and if you didn't have negative symptoms like nausea, vomiting, if you does not have social problems, for example, your parents didn't notice that you smoked the weed, in this case, potentially you have more percentage to be dependent In the case of caffeine, alcohol, cannabis, and perhaps also some hallucinogens and phencyclidine, the substances you use for many persons to stay at the recreational level. Also, a progression to abusive use may occur with any of these. A progression from the recreational to abusive use appears more common for the tobacco or the stimulants, especially caffeine and opioids. The likelihood of this progression is increased with intravenous use or with smoking crack or cocaine. It means if the person starts using the intravenous use, in this case, the likelihood to occur the dependence is very high. In some cases, these people who started to use psychoactive substances, they can become the dependent. And this dependence is caused by different specific features. One of the main features why people continue taking psychoactive substances is the relief. Relief, what does it mean? It means that in some cases, every person who becomes dependent, they understand that they have problems with the use of psychoactive substance. And in a lot of cases, these people want to stop taking them. But when the person stops taking psychoactive substance, they have the withdrawal symptoms. Withdrawal symptoms, they lead to the thing that the person cannot function adequately. For example, if you'll imagine that the student of medical university were drinking weed for 3 years, and on the third year, the person understood that he become dependent or she become dependent. For example, the boy found the girl, and the girl says that you have to choose. You smoke your weed or you will have relations with me. We cannot be together in your life. And the person understood that he has to choose the loved one. Yeah, and in one day, the person wants to stop smoking weed. And after 2, sometimes 3, even on the second day, in some cases, the person understands that there are specific symptoms that lead to the inability to function. Problems with concentration, it's aggression, it's problems with sleep, it's inability to think adequately, it's social problems. So the person cannot cope with normal life situations. And it leads to the thing that the person understands that if I will not use a psychoactive substance, I will be not adequate in the life. And it become one of the main features why the person continue taking psychoactive substances. If you're talking about the addiction or dependence, in these cases, the patient experiencing the overwhelming the compulsion to the use of substances and are driven by that compulsion to repeated use despite the most disastrous consequences. It means that the person have these thoughts that comes again and again, and the person have to satisfy these thoughts, because if he will not do it, it will lead to the problems. If the person have the craving to use the psychoactive substance, the denial becomes severe. It means that in most of the cases, people on the beginning of the dependence, they say that they don't have any problems. They say that they can control, they even believe that they can control the use of psychoactive substances, and it become a huge problem to stop doing it. Because in most of the cases, when the person starts taking, for example, amphetamine, cocaine, or cannabis or salts, there are no specific arguments why not to use. The person says that I just enjoy and it's okay, I can control, I use it sometimes, I don't use it every day, I will never be dependent from these substances. I am the strong person, I understand what I'm doing. So, and the person believes that it is controllable use, but it's in most of the cases, it's not controllable use. One of the things that you also have to know that every psychoactive substance have its own dependence potential. Dependence potential is like the potential that leads to the dependence of the substance. In this case, there are few main features. It's pleasure, it's psychological dependence, and physical dependence. And depending on the interrelations between these things, we can say that there is dependence potential. So when you will look on this slide, you can see that the first place it's heroin. It's opiate, natural opiate. It's like substances that are made from the poppy flower seeds or poppy flower. The second place is cocaine, and on the third place is tobacco. So we know that a lot of people are dependent from the tobacco, and it become a huge problem to stop taking the tobacco. Then barbiturates, alcohol, benzodiazepines, amphetamine, cannabis, and ecstasy. So, speaking about the use of tobacco, I didn't understand how people can use or cannot use the tobacco. I'm the ex-smoker. I smoked in my life twice, but for a few years. The first time when I started smoking, I were 8 years old, and I smoked till 17 years old. So I were smoking during the 9 years. When I finished the school, I stopped smoking, and during the study in the medical university, during 6 years, I didn't smoke. Then when I were on the internatura, I started smoking again, and I were smoking during 4 or 5 years. So during the last 10 years, I didn't smoke. And I know what does it mean to be dependent from smoking. I told that I didn't understand that people who can smoke, cannot smoke, can control their smoking. I didn't understand it until that moment when I found the publication. It is known that near 60% of people, they are dependent from smoking, and near 40% of people, they are not dependent from smoking. It means that they can control their smoking, and they don't have the symptoms of dependence. I think they can control the symptoms of the dependence when they don't smoke for long periods of time. It means that this category of people, they can smoke sometimes, and they can stop smoking if they don't want to do it. Most of people, they have huge problems with controlling this nicotine addiction. Speaking about the alcohol dependence, we have to say that in the Europe, in the US, it is the most widespread type of the dependence. In the Arabian countries, the smoking of weed is the most widespread type of dependencies. So alcohol, it's a specific substance that affects almost every organ and system in the body. And we know that in the high doses, it can cause a coma and the death. We know that every psychoactive substance that leads to the dependence is the poison that have the central effect. It means that has effect on our brain. So speaking about the alcohol, we know that it goes through the hematoencephalic barrier. Hematoencephalic barrier is specific filter that does not give the ability to the poisons to go to the brain and to affect it. And all these psychoactive substances that we are talking about, they can go through the hematoencephalic barrier and have negative influence on the brain. So we know that alcohol influencing on the brain, it affects several neurotransmitter systems in the brain. They include typically opiates, it's GABA, gamma-aminobutyric acid, it's glutamate system, serotonin, and dopamine. We know that if the alcohol have influence on the opiate level, for example, if it's increased, it can explain the euphoric effect of the alcohol. If we are talking about the effect on the GABA, when it increases the GABA, it can explain the anxiolytic and sedative effects. So depending on the amount of the alcohol, we can say that it has different types of effects on the brain. We know that alcohol inhibits the receptors for glutamate. Glutamate is the stimulation neurotransmitter. It uh, helps the person to be active. Long-term ingestion results in the synthesis of more glutamate receptors. When alcohol is withdrawn, the central nervous system experiences the increased excitability. Persons who abuse alcohol over the long terms are more prone to the alcohol withdrawal syndrome than persons who have been drinking for the short period of time. The brain excitability caused by the long-term alcohol ingestion can lead to the cell death and cerebral degeneration. Also, it can lead to the Wernicke-Korsakoff syndrome, to the tremor, alcoholic hallucinosis, delirium tremens, and withdrawal seizures. We know that opiate receptors are increased also in the brain of recently abstinent alcoholic patients, and the number of receptors it correlates with the craving to the alcohol. I explained you why does it occur. It occurs because every receptor is a specific um, structure that works with specific type of the substance. It's like if uh, we have, for example, glutamate receptors, they work with the glutamate. If we have serotonin receptors, they work only with the serotonin. And if there are a lot of receptors, every receptors need more serotonin or more glutamate that were increased while the substance were used. If the person stopped using the substance, in this case, the amount of a neurotransmitter decreases and every receptor is hungry, and it leads to the negative effects. So, what is alcoholism? Alcoholism, it's also known as the alcohol dependence, is a very common disorder. It's chronic mental disease that typically occurs in people that lives in the Europe, in the US. At all ages, alcoholism is more common about the males and than in females, but uh, it's typically occurs later in the females. In our days, the ratio tends to decrease in the higher age groups. Overall, the ratio is probably 3 to 1. It means that 3 men, or even now 2 men to 1 woman. During the last 20 years, this ratio changed. Why does it change? During the last years, the low alcohol drinks are very widespread. Most of girls, women, they prefer using these low alcohol drinks, and when they drink them, they become dependent. 20 years ago, for example, when I were a pupil of the school, for example, there were few types of beer. For example, we had five types of different beers, and we didn't have low alcohol drinks like brandy cola, rum cola, garage, and others. In our days, we have 50 types of beers, and we have different types of or 50 types of different low alcohol drinks except beer for girls. And this drinking of low alcohol drinks will lead to the dependence of girls. So the ratio is decreased to 3 or even 2 to 1, and previously it were 8 to 1, 7 to 1. So the girls are running after boys with the desire to be dependent from the alcohol. What is the statistics of the alcoholism? We know that near 10% of the population, they are the problem drinkers. We know that alcohol is the most widespread illicit drug for teenagers. If you're talking about the oral, it's marijuana. We know that near 15% of all the car accidents it's caused by the alcohol, and 50% of pedestrian accidents they occur in the intoxicated alcohol state. Typically, alcoholism, the onset of alcoholism is very early. As a rule, it's late teens or early 20s, but you can notice the problem after many, many years of the presence of the disorder. As a rule, the person have noticeable symptoms that can be recognized by others. It's late 30s, 40s. It means that 15, 20, 30 years pass after that moment when the disorder become noticeable. And in this case, it's very problematic to treat this disorder. Also, we know that in some cases, alcoholism can occur in people on the late age, for example, after the 30s. What are the clinical features? The urge to drink may be experienced as a craving or imperious need or a compulsion. It's one of the main symptoms of the alcoholism. We know that almost all the alcoholics, they deny that they have a problem with drinking or rationalize it one way or another. What does it mean? It means that the alcoholic is looking for specific sins, logical sins that lead to the drinking. For example, it were difficult week, so I have to relax. Or the alcoholic say that it's big holiday, so let's drink to increase our mood. Or I want to sleep good today, so I have to drink some alcohol. I cannot communicate very well with other people until that moment when I drink, so let's drink, and something like it. Alcoholics are often quick to lay blame for their drinking on the situations of other people. So I'm drinking because I have bad social relations. I'm drinking because I have difficult job. I'm drinking because I'm very anxious and I'm sad. So let's drink. Stressful events may be followed by the increased alcohol consumption, but the alcoholics they can be also in the intoxicated state during the good times and simply on the neutral times of their life. Most alcoholics they are trying to control their drinking, so they make the attempts, and we can say that these attempts they are successful, but they are very short-lived. It means that they can control their drinking for very short periods of time. In some cases, it can be few days, few weeks, few months, but still, alcoholism is chronic mental disease. Chronic mental, it means that there are periods of the exacerbation, periods of the uh, normal states, but still the person is dependent. The loss of control is one of the main points considered, it's the main hallmark of the alcoholism. Loss of control, it means that the person cannot control their bad habit. Uh, if we are talking about the average person who does not have the dependence, you don't have to control your drinking. You can just drink or not drink without any effort. If you're talking about the alcoholic, the person who is dependent from the alcoholism, these people, they need to control their drinking. They have to make big efforts to stop drinking or not to drink or to drink less that they want to drink. When alcoholics start drinking, in most of the cases, he drinks until that moment when there is no alcohol or until that moment when the person is very drunk. So this ability to control drinking is also a huge problem. Alcoholics drinks in all the spheres of their functioning. They can drink on the job, at home, with friends, everywhere when they drive in cars. So it leads to the thing that the friends are lost, the health problems occur, the marriages are broken, children are abused, jobs terminated, and even looking on these problems, the person continue drinking. Also, a lot of alcoholics they have the changes in the personality. It's specific changes that are caused by the life that is associated with the alcohol. We know that alcohol destroys every organ and system, and first of all, it destroys brain. Brain is destroyed, and it means that people become very specific. Specific, it means that they have decreased ability to analyze. They have um, a lot of other symptoms. We will talk about them later. Most of alcoholics, they display an alcohol withdrawal syndrome when they reduce or temporarily feed the consumption. They can wake up with the shakes. Shakes, it means that they cannot even take something in their hands because they are shaking so much that they can control this type of behavior. And because of this shaking, they have to drink some alcohol to reduce these withdrawal symptoms. As we told before, all the dependencies, they are characterized by the presence of the tolerance. Tolerance is also the symptom that typically is present in almost all the alcoholics. It means that they can drink big amounts of the alcohol and they drink it to become intoxicated, to have the desired effect. Um, Alcohol intoxication is a specific term that is characterized by the presence of some amount of the alcohol in the blood. So that alcohol level by the convention may be expressed as milligrams per deciliter, so it's often charted milligrams per cent. Roughly speaking, in the 70 kilogram person, blood alcohol level rises anywhere from 15 to 25 milligrams deciliter every 15 liters of rapidly ingested pure ethyl alcohol. This amount of ethanol is found in one bottle of beer or about one glass of wine. Given that most social drinkers, alcohol naive persons, become intoxicated on the blood alcohol level of 100 milligrams deciliter. Um, it's about 4 drinks. So there are different stages of alcohol intoxication. It's mild, moderate, and severe. Speaking about the mild alcohol intoxication, we are talking about that thing that most of the people, they feel euphoria. They become more talkative, they have better desires, better mood, they does not have complexes, and it become the main things why these people prefer taking alcohol. In some cases, these people can be irritable, can be anxious, but it's not typical situations. Also, people in some cases can be suspicious and mildly depressed, tearful, and morose. If you're talking about the moderate alcohol intoxication, in this case, the behavior tends to become coarse. Inapproprieties become common in this state of intoxication. Thinking is slowed, people become inattentive, the person become retarded, they need more time to answer the questions, they become more retarded if you're talking about the ability to control their behavior, for example, driving car or understanding what they are doing. This stage is characterized also by the problems with the coordination and problems with the speech. And if the person continues drinking, in this case, it goes to the severe stage of intoxication. And we are talking about the stage when the person has problems with the consciousness. As a rule, we are talking about the stupor or coma, sopor coma. People who are in the severe alcohol intoxication, they can die. People are dying from the alcohol because they have the tumor of the brain. So you have to remember about it. If your friend or girlfriend or husband or some of your relatives come home and in the intoxicated state, and for example, there are problems with the consciousness, in this case, you have to think about that feature that this person can die very quickly because of the tumor of the brain. Blackouts or palimpsests. They are also the specific symptoms that's typically present in almost all the alcoholics. It states that are characterized by the losses of memory on the event that were during the intoxicated state. People don't remember scenes when they were drunk. The person can wake up in the morning and to think what was yesterday. They remember typically till some situation, and other memories are absent. For example, they wake up in unknown place with unknown people, and they can found the cars broken. They can found some blood, for example, on their body, and they don't remember what happened yesterday. As a rule, these blackouts of palimpsest, they lead to the anxiety of people. They are looking for people who were with them. They are asking about the situations. They are trying to find the information, what was yesterday, and they are trying to satisfy their uh, interest about it. Alcohol withdrawal symptoms, it's also seen that typically present in the alcoholics. As a rule, we are talking about the alcohol shakes. It has specific term. People who stop drinking and who are dependent on the alcohol, as a rule, they have anxiety, they become easily started, they may have the agitation, they can have the depressed mood, irritability, irritable, the tremor, they cannot perform any activities, job, and it become the main problem about why people uh, drink alcohol. Also, it can be the headache, the dry mouth, anorexia, nausea, vomiting. Alcohol withdrawal seizures is also one of the symptoms that occurs in this category of people. These seizures, they have specific term as RAM fits. They occurs from 1 to 3% of the patients that are withdrawing from the alcohol. The most part of the alcohol withdrawal seizures presents as otherwise unremarkable generalized tonic-clonic seizures. In about a quarter of the cases, however, the seizures have a focal onset. Most patients, they have just one seizure. Occasionally, however, the patient have a cluster of 2 or 3, and rarely as many as 6. And in some cases, even the status epilepticus can occur. As you will work with the patients, even if you will not be the psychiatrist, you have to remember about one specific feature. One specific feature is delirium tremens. We know that almost near 30% of the people who are hospitalized in the average hospitals, it's people who have problems with alcohol. And it means that between these people, you will have near 5% of people who will have the delirium tremens. Why does it occur? As a rule, delirium tremens occurs in the patients who are withdrawn from the alcohol. Withdrawal of the alcohol leads to the specific features of disorders of consciousness. First of all, the person becomes anxious and understand that something is going on around. And the person does not understand what is wrong, but this anxiety is increasing. After increasing the anxiety, as a rule, in the evening, the person loses the ability to understand where is he or she and what is the day. It means that the person loses orientation in time and place, and the orientation in the own person is still present. After it, as a rule, the person will have the visual hallucinations and the delusions. If you're talking about the typical visual hallucinations in this category of people, they are micro or black and white hallucinations. It means that there is people, they see small black and white pictures. For example, it can be worms, it can be mice, it can be rats, other animals, and as a rule, they lead to the huge anxiety. Also, these people can have the auditory hallucinations and tactile hallucinations. They can feel like the worms are scrambling on their skin. They can hear the voices that are talking with them, and they feel fear. Also, these people can believe that others people want to kill them, that the food is poison, that doctors are not doctors, that they make experiments from the patients on the patients, and it can lead to the specific type of behavior. So you have to remember that thing that the behavior of the patient, as a rule, depend on the psychopathological symptoms that are present. So if the person can see that uh, on the ground there are mice that are trying to bite him, the person will try to run and to jump on the high things, for example, on the bed. Or, for example, if the person believes that the doctor is not a doctor, but the person who wants to take his brain or to put some chips, or who wants to contaminate with microorganism the person can be aggressive, can try to kill himself, to run somewhere. So this inadequate behavior typically is caused by the delirium tremens in people who are in the hospitals. So memory typically is not present on the most of the events. Sometimes they have um, memories on the some events that were present during this state. Also, you have to understand that in some cases there is a quiet delirium when the person is laying in the bed and doing nothing, just anxious. And in some cases, this quiet delirium can become the overactive delirium, and the person is running, attacking others, trying to hide. Then again, it can be quiet. Speaking about the delirium, it's also a specific state that is characterized by the fluctuating state. It means that the person feels better in the morning and in the noon hours and feel much worse, and the symptoms occur as a rule in the evening and night hours. So we had some cases when we know that the patient have delirium tremens during the night. We take the group of students to the person, to the patient, and when we come to the department in the morning, there are no symptoms of delirium. Then in the night, also the person have disorientation and delayed behavior. So delirium is fluctuating state. Alcoholic dementia, it's often specific disorder that is characterized by the symptoms that occur because of the destruction of the brain. Patients become coarse and heedless of the social convention. They may become apathetic and judgment is poor. Cognitive deficits eventually appear. Short-term memory fails and the patient gradually have increasing difficulty in recalling events of their distant past. Their thinking becomes concrete, and people also can have apraxia, agnosia, and other symptoms. If we look on the MRI and CT, we can see the cortical atrophy of the brain. It means that the structures that are typically are in the brain, they are more seen in this category of people. A lot of alcoholics can also have the alcoholic paranoia. Paranoia, it's specific presence of the delusions of, for example, jealousy. It's one of the most widespread. The spouse is suspected of uh, infidelity. People believe, alcoholics as a rule believe that their spouses, they can have other loved ones, that they can have sexual relations, and sexual relations are very absurd. For example, they believe that while I were in the shower, our neighbor comes to you and you had sexual relations. And even if you tell the patient that you were in the shower only during 2 minutes, he will not believe that it were not present in the life of the person. Alcoholic paranoia, it can also be connected with hallucinations. But hallucination doesn't play the main role on this state. People can believe that the food is spoiled, rotten, perhaps even uh, they believe that others want to kill them. Uh, Speaking about the psychoactive substances, we have to say that there are three types of narcotics that typically are present in the life of every person. The first group of narcotics, it's substances that have psychostimulating effect. People use them to be more active, to have more energy, to be more communicative. They have decreased need in sleep, decreased need in food. They can have sexual relations more easily. And all these features that they are related and they're connected with the pleasure, with the euphoric effect. So in this group, we have, like, for example, caffeine, it's amphetamine, it's cocaine, and salt. So people use them to be more active. As a rule, psychostimulants, they are used by people who have active nightlife, but sometimes it can be in people who, for example, need to work during the nights. I had a patient that were working in the Poland. He went from Ukraine to earn some money to the Poland, and he worked during the nights. And he told that I tried some amphetamine, and he helped me to work during the nights. It means that it gives more energy, more ability to work. And because of it, the patient became dependent from this amphetamine. So psychostimulants, it's typically the narcotics of golden youngs. It means that people who have money and who like to be on the discos. As a group of psychoactive substances, it's opposite to them. It's sedatives or depressants. People typically use them because they like the effect of them. The main effect is euphoria. Euphoria is a state that characterized by the presence of pleasure and when you does not care what is going on around. People enjoy this state even if there are a lot of negative things around. As a rule, we are talking about the benzodiazepines, we are talking about the opiates in this group. So people are taken to forget everything that is around and to enjoy being here and right now and right here. And the third group is psychedelics. Psychedelics, they have other main effect. They change the reality. They change the level of consciousness and lead to the presence of the illusions, delusions, hallucinations. So it's substances that typically are taken to understand the world better, to understand yourself better. People prefer taking them to go to the different world, to understand how the brain is working, to understand what is life. These substances typically are taken by people who want to discover different parts of the soul. It's the main substance from this group is wheat. Yeah, it's cannabis. Also, it's LSD. It's different types of mushrooms and other psychedelics, like there are cactuses, peyote. So people are starting to use psychoactive substances, and nobody knows who will be dependent and who will not be. If you will ask my uh, if you will ask me what do I think about the use of psychoactive substances, I will tell you 100%. The best way that you can do it's not to try, because if you will try and you will understand that you enjoy taking psychoactive substance, in this case, potentially you can become dependent. And if you will become dependent, it means that you will lose ability to control your life, your behavior, and everything that is related to the psychoactive substance. It means that potentially you can destroy your life, your future, your health, and everything. So the best way is to enjoy living here right now and being abstinent from the psychoactive substances, as people who are dependent say. So I wish you to have a great mood without the using of psychoactive substances, and thank you very much for the lecture.